Community Education Project, COVID-19 Vaccine by Grace Maroney. The possible types of COVID-19 vaccines. The first is the mRNA vaccine. This contains material from the virus that causes COVID-19 that gives our cells instructions for how to make a harmless protein that is unique to the virus. After our cells make copies of the protein, they destroy the genetic material from the vaccine. Our bodies will recognize the protein should not be there and build T and B lymphocytes to fight the virus if we are infected in the future. The second is the protein subunit vaccine. This includes harmless pieces or proteins of the virus that cause COVID-19 instead of the entire germ. Similar to the mRNA vaccine, once vaccinated, our immune system recognizes the proteins and makes T lymphocytes and antibodies. Memory cells will recognize the virus in the future. Vector vaccines contain a weakened version of a live virus different than COVID-19 and genetic material from the COVID-19 virus, also known as a viral vector. Once inside our cells, the genetic material gives our cells instruction to make a protein that builds T and B lymphocytes that remembers how to fight the virus. There are currently 5 COVID vaccines undergoing clinical trials in the U.S. AstraZeneca's, Janssen's, Moderna's, Novavax's, and Pfizer's. The COVID-19 vaccine will be important in stopping the pandemic. A vaccine will help minimize the serious and life-threatening effects of COVID-19. Natural immunity and vaccine immunity are important aspects of protection. The vaccine will keep you from getting seriously ill even if you do get COVID-19. Approximately 1.4 million people have died worldwide to the coronavirus. So who gets a vaccine? In a 13-1 vote, the ACIP, or Advisory Committee for Immunization Practices, said healthcare workers and residents of nursing homes should be the very first in line. Here are a few vaccine myths debunked by Azim Majid, a professor of the primary care and public health at Imperial College London. The vaccine could give you COVID-19. Some vaccines contain germs that cause the disease, but they have been killed or weakened to the point that they will not make you sick. There hasn't been enough testing. Results show that the vaccine is safe against all the groups that they have been tested on so far. If you get coronavirus once, you are immune. No one is clear on how immunity will last. And that's it.